My name is Mindy Counts. I founded the Inner Ocean Empowerment Project because, like many of us, I could see that in our world, there are some major socioeconomic disparities. These imbalances lead to vast differences in access to resources, especially healthcare and education. As a nonprofit, the mission of the Inner Ocean Empowerment Project is to reduce this gap by supporting and providing communities opportunities for healthcare and health education. As a holistic medical practitioner and 5-element integrative acupuncturist, I've led volunteer healthcare service missions to populations in need around the world. I'm drawn to this nonprofit work in part because the results are immediately rewarding as well as long-lasting. There's nothing like seeing the look on someone's face when they can walk without pain for the first time in many, many years. Or to see women use skills they learned in your class to save the life of a child or to bandage a wound. It's the support of our generous donors that makes this work possible. The term inner ocean comes from ancient Taoist and classical Chinese medicine. It refers to that deep reservoir we have within all of us that we can draw energy from and resources from throughout our entire lives. When this reservoir is depleted, we may feel exhausted, hopeless, more vulnerable to imbalances in body, mind, and spirit, and especially vulnerable to trauma and oppression. But when this reservoir is full, we feel a sense of belonging, we feel connected, and when life throws us curveballs, we feel resilient. We traveled to Nepal in 2014 before the devastating earthquake in Sindhu Palchak destroyed 97% of all their buildings. In 2016, we returned to find a community shattered after such loss and with very little access to the resources they would need to repair, both psychologically and physically. During our first trip to Nepal, we discovered that the people there had limited knowledge of basic health care. We could see infected leech bites on all the children's legs, getting treated with toothpaste or contaminated water. We found many people struggling with dysentery and chronic pain. In talking to the women of the villages in Sindhu Palchak, referred to as the mothers, we found out that they were very interested in learning how they could help their own people by learning basic first aid and CPR. So, we organized a trip to make it happen. In 2017, we returned to Nepal with a group of volunteer healthcare practitioners, trekking as many as 10 miles a day to reach the mountainside clinics.
She came from Golchi, which is like a couple of hours from here.
A couple of hours walking?
Yeah, for the local people.
That's a long ways. Thank you for coming.
Sometimes we found people had been waiting for us for 2 hours or more. Some of the most common health conditions we treated were infected wounds, dysentery, PTSD, chronic pain and inflammation of the back and the joints. One of the most powerful moments of this trip for me was when a patient and a translator came to find me during one of our most rural and busy clinics, and the patient was so excited to share with me how amazing he felt after his treatments.
So he has a back pain and feels burning feet. So he came here for the treatment. So now he's feeling better.
He was stretching his arms in the air to show me all the movements he could do now. With tears in his eyes, he just kept repeating that he has no pain, no pain. It was amazing and reminded all of our volunteer team members about the difference we can make. When someone lives in such desolate conditions, guiding them into what I call health literacy will support them in their communities for the rest of their lives. In January of 2018, we launched our first wilderness first aid and CPR training for the mothers of the many villages of Sindhu Palchak. The feedback and gratitude we received from the people we supported was so touching, and it reminded me that the best way to be of service in our world is to share resources when we have an abundance of them. But above all else, it is to empower those who have been disempowered so that they can lead their lives from a place of resilience and integrity. When I work with people in some of the poorest areas of the world, I can't help but to see that their children are no different than the children here in America, and I see myself in all the women we work with and support. The Inner Ocean Empowerment Project is a small nonprofit that operates from the heart with very little money. The biggest need of our nonprofit is financial support so that we can sustain this important work. Our donors make our volunteer work possible. For more information on ways to support our work, please visit our website.